Hey, I'm Jose Almeida, and thanks for joining me for another IBC Community Talk. Um, if you've listened to a couple of these, you have a good idea what we're trying to do here now. Many of you have been coming to IBC for the past 22 years, and we thank you for doing that. And one thing that's come to light recently is the decrease in reimbursement for our procedures. So, vein practices have taken a big hit in reimbursement. In order to offset that, uh, we feel that ancillary services um, are needed to supplement the revenue to the practice. We don't want to have to go and be employed by a hospital. We are office-based people. Most of us have been doing office-based venous surgery for a while. We like our independence. We like our autonomy. And these ideas that we're putting forth are ways that one can enhance their practice to remain in the office, even ways to wean off this insurance-based medicine into cash-based medicine. So that's really the underlying theme of these talks. So today's talk is going to be about the stress and adrenal dysfunction. Well, that doesn't sound very sexy, but let me hopefully indulge you with the next few minutes with this talk, and you'll see some things that maybe you weren't aware of. I've been learning more and more about functional medicine and getting more and more into it, and really like it as a nice piece to the practice. So let me share a couple slides. Okay, so what I would like to accomplish in this talk is to discuss how stress is a major contributor to health issues, the connection between stress, adrenal function, and overall health. And then the goals would be to understand the causes of adrenal dysfunction, impacts on hormones, and strategies for management. Now, about me. So, most of you know that I've been in sports since age 8, got into competitive bodybuilding, have been a gym owner. So for me, nutrition and exercise has been a lifestyle, a staple of my life uh, since I was 8 years old, and now I'm 60. And I still do this, lift weights every day, do my cardio, try and eat a clean diet. And that's the recipe for health. Of course, there's some luck involved, some genetics, but something that one can control is the nutrition piece and the exercise. What the hell does that have to do with adrenals? So stress, major, uh, piece of all of our lives. There's no way to escape it. We think we may not be stressed, but there are multiple stressors, a couple of which we'll discuss. It can be emotional, it can be your relationships. Somebody who's had a death in the family, you may think you cope well. That's still a stress. And all these stresses are cumulative. There's toxic stress, environmental stress. So our foods, a lot of processed food, they have chemicals. Our bodies need to process and detox that. So if we don't have healthy livers, we're not going to be able to detox properly. Oxidative stress will be produced, and that's a stress to the system. Environmental, just driving in traffic and smelling fumes, that's toxins which cause stress. So multiple stressors, we can't escape it. So one needs resilience in their system to stay well. And cortisol is a major actor in that. So let's keep moving along here. This is, about me, uh, and my background, and why I've taken an interest in functional medicine, because for me, it's a natural fit. The past years, I've been, going at this a little bit. So we started in 2018 with a hormone replacement company called BioT. They gave a good educational program, and known for pellet placement of hormones. they've kind of broadened out and they're getting more functional. Done courses with the Institute for Functional Medicine. I'm currently studying an online program with the Kalish Institute, which is the lab interpretation piece of all this. Now, I've also learned things from some of our aesthetic uh, partners or vendors. So we've bought some devices in our, aesthetic MediSpa, which help us over here, BTL, the M-Sculpt Neo, to put on muscle and burn fat. That's helped us in multiple things, including our weight loss program with GLP agonists. So we use a DEXA scanner and we use these devices. So people are losing weight, we maintain muscle while they're losing fat. Mode, another big company that we use here, we have their devices. My radio frequency microneedling is the main one for aging skin. Just a point being that we're here at Miami Vein, is now called Miami Vein and Wellness. We are incorporating other services, cash-based services, so that we can remain as independent office-based practitioners. And that's kind of how I've been kind of rebranding myself. In 1998, I finished my vascular surgery fellowship, which, of course, vascular surgery is mostly arteries, or one goes into it with the idea of fixing aortic aneurysms, carotid endarterectomies, lower extremity revascularization. Then, of course, came the endovascular devices. But in my mind, I was an aortic surgeon for a long, long time, doing big procedures, emergencies. And then in 2003, kind of weaned off of that into a venous practice, been venous ever since. Had a nice run with veins in terms of, a good practice with the reimbursement or compensation was fair. But the last 10 years, we just keep getting cut and cut and cut to now where the venous practice, even though we're busy, is struggling, with the high overhead that it takes to run these things. I mean, we have all the toys. So we've had to add additional services to support the vein practice. And now it's to the point where it's half our practice doing, what I would call wellness. Wellness to me is all this that you hear: longevity medicine, anti-aging, integrative medicine, functional medicine, all that stuff. It's wellness. So sick care versus well care. Then most of us MDs are trained in sick care, dealing with acute disease. Certainly surgeons, we are sick care people, dealing with acute problems. This is a well care piece, keeping people well, different mentality, completely different mentality. And folks want this. You see all the biohacking now online. Of course, we got all the social media and all the things that take place in social media with wellness. Everybody's got their own formula. Take this supplement or take that supplement. Joe Blow over here takes this and he looks good. What we're trying to do here is more of a, scientific or organized approach. So my idea of functional medicine is what I'm learning now is through lab work, through data, identifying deficiencies, and then replacing those with whatever it takes. If it's supplementation, exercise, nutrition, it's usually all the above. The stress response system, the hypothalamic pituitary axis, or HPA axis, defines the hypothalamus talking to the pituitary, which then talks to the adrenals through hormones. Cortisol releasing hormone from the hypothalamus goes to the pituitary, which then produces adrenocorticotropic hormone, which then goes to the cortex of the adrenal to produce cortisol and some other products. If cortisol gets high, it's a negative feedback onto the brain to produce less cortisol. There's the HPA axis, which is this one. There's the HPT axis, hypothalamic pituitary thyroid. Similar mechanism, different peptides up here. Hypothalamic pituitary gonadal axis, the testes producing testosterone. Similar process, different peptides coming from the hypothalamus pituitary to talk to the testes. All right, so this is a very important hormonal mechanism in our brain. What's that have to do with stress? So the adrenal gland is made of the cortex and the medulla. The cortex produces mineralocorticoids, glucocorticoids, and androgens, salt, sugar, sex. Okay. The medulla produces catecholamines. This is controlled by the sympathetic nervous system, and there's other peptides that are produced by the adrenal. These are the zones of the cortex, but basically, this is how things function. So the HPA axis, this is just to say that sex hormones are also produced by the adrenal gland, not just the gonads. This is the main player coming out of the adrenal cortex, cortisol and aldosterone, but we're going to focus on cortisol today. So as far as steroid hormone production, the backbone is cholesterol. That's why people or media getting cholesterol down, demeaning cholesterol like some poison. We need cholesterol for our sex hormones. We can't produce testosterone without cholesterol. Our lipid membranes are cholesterol backed. The point of this slide is that cholesterol gets converted to pregnenolone. Pregnenolone is a precursor to progesterone. Progesterone is a precursor to cortisol. Pregnenolone is also a precursor to aldosterone. Pregnenolone is a precursor to DHEA, which is a precursor to estradiol or estrogen. DHEA is also a precursor to testosterone, these other pathways. So cholesterol is very important. So is pregnenolone. So is DHEA. We're talking about cortisol. So I'm just showing you this as the landscape for the biosynthesis of steroid hormones. And we're going to get to a little concept here called cortisol steal in a minute. Us conventional folks, when we learned about the adrenals, so medical doctors, I'm not telling you, I haven't told you anything new, nothing you don't know. But the way we really learned it is on the disease side. So too much cortisol, Cushing's, adrenal insufficiency, deficiency of cortisol, Addison's disease. Of course, John F. Kennedy famously had Addison's disease. These have treatments, but this is when HPA dysfunction gets to a disease state. With functional medicine, the idea is to start picking things off earlier. So stress, and this is the crux of the talk here, finally getting the punchline. Stress, any type of stress, affects the brain. That's the input organ, which now starts telling the hypothalamus to talk to the pituitary to produce ACTH, to tell the adrenal gland to produce cortisol. Stress, cortisol, our stress response produces cortisol. We need that. But too much cortisol will start to inhibit metabolism, inhibits insulin. So you can imagine glucose or sugar regulatory dysfunction. High cortisol will inhibit the gut, the GI system, inhibits gastric acid. Too much cortisol will feed back on the pituitary, will feed back on the hypothalamus, tell the brain we need less cortisol. Too much cortisol hurts the immune system, production of cytokines and chemokines. These also have feedback to the brain. So too much, we need stress, or we have stress, too much stress for too long starts to affect these systems. We don't want it to get to where it's too late with frank disease states. Cortisol and DHEA affect carbohydrate, protein, and lipid metabolism. They serve as anti-inflammatory agents, modulate thyroid function, and increase resistance to stress. The HPA axis, hypothalamus, pituitary, adrenal, you can think of it as, kind of right next door to the hypothalamic pituitary thyroid axis. So there is some crosstalk between cortisol and thyroid hormone through these mechanisms. Cortisol is a primary glucocorticoid involved in regulation of glucose metabolism in the body's response to stress. So glucose regulation is highly influenced by cortisol or stress. Stressed out people eating donuts, going to food, going to sugar. There's mechanisms for that. This is a neat concept called the allostatic load. It's defined as a cumulative physiologic effect of the body's long-term response to stress, has been correlated with degenerative diseases and aging. The allostatic load, the cumulative effect of stress, or talk about it as resiliency. Our bodies need to be resilient to stress. Adrenal insufficiency, adrenal fatigue, adrenal burnout. That's when we start losing our resiliency to stress, and then other things start happening in other body systems, such as the gut, such as the brain, such as the liver detox capabilities. This is functional medicine. So, nutritional deficiencies. Let's get down here, sorry. Nutritional deficiencies, genetics, insulin balances, inflammation, which can come from anywhere, the gut, anywhere, poor methylation, poor sleep is a big one, inflammatory fat, GI dysbiosis is our microbiome friends in the gut being dysregulated, hyperpermeability, leaky gut. So all these things can cause hormonal dysfunction, which can cause signs and symptoms. This is the diurnal or the circadian rhythm of cortisol, super important. When we wake up, we should get a cortisol spike. This can be enhanced by putting light in your eyes. So one of the first things one should do when they wake up, go outside, get 10 minutes of light. There's a stimulatory effect. We want the early morning rise of cortisol. Then as the day progresses, cortisol levels should be kind of creeping down. And prior to sleep, cortisol should be low. Okay, this is a normal cortisol rhythm. And we'll get into some more slides of what an abnormal cortisol rhythm might look like. The adrenal gland produces much more DHEA than cortisol. Fluctuating amounts of DHEA and cortisol may signal important alterations in adrenal function. So we can measure DHEA and cortisol with labs, saliva. So we'll talk about one of the tests that we can identify these problems. By looking at the testing, which will show us this cortisol response throughout the day, we can then develop a therapeutic plan. So that's really to introduce the idea of what cortisol output from the adrenals should look like. Should be higher in the morning, decrease throughout the day, be quiet at sleep, bedtime. These are the common symptoms that patients present with: weight gain, fatigue, depression, GI, female hormone imbalances. What's most interesting about this slide to me is such vague symptoms. Let's talk about fatigue. Fatigue can come from anything. One bad night of sleep, you're fatigued. Vitamin deficiency, fatigue. Under-exercise, fatigue. Over-exercise, fatigue. Common cold, fatigue. Changing your diet from carbohydrates to fats, early fatigue till you adapt. So many things can cause fatigue. You need all the amino acids to produce proteins. So if one amino acid is deficient, you can't properly produce proteins, you get cellular dysfunction, specifically once we get into the energy pathways, such as the Krebs cycle electron transport chain. We'll get into this in more detail in other talks, the importance of the mitochondria and energy production. But just simple amino acid deficiencies can cause fatigue. So someone presents to you with fatigue, that can mean anything. And that's why I think the testing is important. That's what the part I like about this functional medicine. Here we go back to the concept of allostatic load. So stimulation of the hypothalamic pituitary gonadal axis, stimulation of the hypothalamic pituitary thyroid axis, adrenal axis, activation or overactivation of the sympathetic nervous system, which of course will produce catecholamines from the adrenal medulla. These up here are adrenal cortex. This is adrenal medulla. So resiliency, stress coping mechanisms, the ability of an organism to maintain homeostasis in response to stress. That's allostasis. The continuing cumulative effects of stress is what we call the allostatic load, and the body's resiliency is the ability to cope with the allostatic load. So let's look up here. Social stresses is the input. Go right to the brain. This causes neural sensitivity to the social threat. The brain now talks to the adrenal medulla or sympathetic nervous system in general to produce norepinephrine, epinephrine, or it talks to the adrenal cortex to produce glucocorticoids. This, of course, is a molecular signaling process, which will then target receptors. Receptors will then cause some type of activity to occur in the cell. So molecular signaling is how hormones work. They get to the nucleus, tells the DNA transcription to translation to protein production to an action. Inflammatory cytokines can be a product of this, too much stress, and then one gets disease. Multiple targets of disease, such as the circulatory system, GYN system here, cardiovascular system. So stress, when you hear about stress causing heart attacks and stroke, that's through these mechanisms. High stress can set up a cascade of downstream consequences. So let's talk about cortisol steal for a second. We already looked at on a different slide how cholesterol is a precursor to pregnenolone, pregnenolone precursor to progesterone. These, of course, are all enzymatic reactions that need to take place. We'll get into the enzymatic reactions later. Progesterone is the precursor to cortisol. DHEA, precursor to testosterone and estrogen. So the point of this slide was stress. If we start producing too much cortisol, the precursors, the substrate, cholesterol, pregnenolone, are going over here. So we are stealing, we're reducing pregnenolone, DHEA for testosterone production or estrogen production. So we actually get sex hormone dysregulation because of cortisol steal through stress. Because again, the brain talks to the adrenal glands, right? Important, very important concept, cortisol steal. Let's see it a little closer. cortisol, pregnenolone. Pregnenolone is no longer being converted to DHEA because it's getting stolen to produce cortisol because of the stress. So this goes on for too long, be it weeks, months, years. Now you get some deficiencies of aldosterone and your mineralocorticoids, and maybe some salt imbalances start occurring. Over here, low testosterone, low estrogen. So stress through this mechanism can dysregulate sex hormones. So somebody presents to you with testosterone low T. Yes, you can replace testosterone with bioidentical hormones. That may not solve the underlying problem, which is up here. So you didn't deal with the stress, and you didn't deal with the hormonal pathways resulting from the stress. Right? That's what functional medicine is. They call it root cause. Yeah. Yeah, I mean, there's deeper roots, right? That one can really get deeper and deeper to causes. This is just to show you another example of how everything is interrelated. And this would be the detoxification functions of the liver. There's phase 1 and phase 2. Since we were just talking about estrogen, I'm using that as an example. So estrogen regulation can be affected by stress. If estradiol gets metabolized in the liver, and these are some of the mechanisms through the cytochrome P450 system, but there are metabolites that one can measure in the urine, the 2-hydroxy metabolite of estradiol, the 4-hydroxy, and the 16-hydroxy. This 4-hydroxy is bad, can damage DNA and be cancerogenic. So we want this low. But phase 1 detox gets us to these metabolites. There's also phase 2 detox, of which sulfation, transferase. So these sulfur-bearing amino acids are involved in this. So we need all of our sulfur amino acids like methionine, cysteine. Methylation is important, and glucuronidation is important. So the liver detox mechanisms have to be tuned to properly metabolize estradiol. Just want to point this guy out. High, so we can do tests. We can see all these on testing. We can also see beta glucuronidase from the gut. So if this is high, beta glucuronidase takes off a glucuride molecule, leaving the estrogen to be reabsorbed. So estrogen can be reabsorbed in the gut, and what we call estrogen dominance. You'll hear it referred to as. What I'm trying to say is you may have high estrogen levels, or a woman with estrogen dominant symptoms, and it's not truly from too much estrogen. It's just poor estrogen metabolism by the gut. So that's why sometimes, or it's big in functional medicine, to go to the gut as the root cause for any type of dysregulation. So in this case, woman comes in with estrogen dominant symptoms. You measure the estrogen hormones, metabolites, glucuronidase, and let's just say that everything starts pointing to dysbiosis producing these symptoms. So a problem in the gut. Dysbiosis is kind of a generic term for your commensal bacteria, or let's just call them microbes, because it consists of bacteria, fungi, viruses. So the bugs, the gut bugs, of which there are over 100 trillion that help us survive, When there's issues in the gut infections, dysbiosis, this can present itself as estrogen metabolic issues, right? I'm just kind of laying a landscape here. So secretory IgA is another big one that we measure on labs, and SIG-A, as it's called, chronic stress decreases SIG-A. Measurement of SIG-A is a biomarker for functional impact of chronic stress on stress hormones. SIG-A forms an immune barrier to protect against the GI tract infections. So stress lowers SIG-A, which can hit the gut, reduce immune function, and cause GI infections, which then cause dysbiosis, which then cause havoc on the rest of the system. So stress can affect the gut. Stress can affect the cardiovascular system. I think you're starting to see a pattern here is that all these things are connected. This is the salivary test. This is by actually Genova Labs. It's a salivary test, and what you get out of here is the CAR, cortisol awakening response, and the circadian rhythm. And you also get some DHEA numbers. The cortisol awakening response is a big one. It should be about 50. So if this number, were 200, you just know something is off for cortisol regulation. Similarly, if the patient's line is, maybe high here and cortisol now spikes up here and stays up here, they have high cortisol throughout the day, that something's going on. And that's how you start directing treatment. So if somebody comes with fatigue, it can be anything. You do a saliva test or adrenal test, and the cortisol awakening response, or CAR, is abnormal. The circadian rhythm production of cortisol is abnormal. The DHEA starts to dip low, cortisol steal. You've got a adrenal problem that you can address to address fatigue, right? So this is what we call an adrenal program, addressing the adrenals. So cortisol going up, it's now starting to use pregnenolone to produce more cortisol. And what we see with stage 1, 2, 3, 4, stage 1, 2, 3 of adrenal dysfunction is that a stage 1, cortisol is high, DHEA is low. Stage 2, the cortisol is dropping. And you'll know this on the test because you're measuring cortisol levels and DHEA levels. Stage 3 is kind of burnout. The adrenals aren't really producing cortisol and the DHEA is low. The DHEA really is one of the key markers. As DHEA is dropping, adrenal exhaustion is taking place, or adrenal fatigue, wherever you want to call it. Cortisol will initially spike as it should, but then the response starts to do this as stressful situations, your allostatic load starts interfering with your resiliency. Your body's taking a hit. Your stage 3 adrenal exhaustion, you're going to have fatigue, maybe other things. So the labs guide us now to the treatment. What can we do for adrenal support? There are DHEA and pregnenolone replacement supplements. And you always want to be doing stress lifestyle modifications such as stress management, meditation, yoga. And of course, we get into our good friend, good nutrition, exercise, rest, and sleep. These are things that one can do to get out of this adrenal exhaustion. It takes months, can take years. But the point is we can identify it on the labs. This would be an adrenal program treatment, DHEA drops, and you're just dripping it in throughout the day. Same with pregnenolone. This resets the HPA axis. These programs usually start for about 2 months, and you can retest, may need to go 6 months, but they're not, the rest of your life. When you talk to your patients, we're just trying to reset the HPA axis. Fosserine is something, if the cortisols are high, it'll help bring it down. If the cortisols are low, you can use a licorice extract to bring it up. You want to always be using multi-packs, which contain mostly B vitamins, lipoic acid for glucose regulation. We said cortisol is a big player for glucose regulation. Fish oil, fatty acid oxidation. There's some other things so you can just cover all the bases. And there's some herbal support that one can use. And that just kind of helps calm things down. So this is what a functional medicine program would look like if the labs show adrenal exhaustion. And then to finish, what I'm learning at Kalish Institute, I like this because they break it up into these 3 buckets: the neuroendocrine system, GI system, and detox. Within neuroendocrine are the adrenals that we just spoke about. There's neurotransmitters we'll talk about another day. We mentioned female hormones. Energy or mitochondria is a big one. Within the GI system, if anybody knows anything about functional medicine, gut is a big player, and the importance of the gut and the microbiome, and liver detox. Okay, so hopefully this stuff makes sense to you, why you may want to add it to your venous practice. Again, I've rebranded Miami Vein and Wellness, so we're all in with this. This gives you a taste of functional medicine and the adrenal program. We'll talk more about this in the future, and we'll go into other aspects like neurotransmitters, GI, detox. There's a lot to learn. We'll bring up some labs later, what we look for on the labs, lab markers. Of course, we'll do more on treatments, how we treat these things. Folks get better. It's not an overnight thing because you need to reset, the system that's been hit for a while with stress or whatever else. The stress is the big one. And people can get better. So, I mean, it's good medicine. It's satisfying. And like anything, you'll learn how to pick the patients who you want to stay away from, who you can help, who you probably can't help, when to use your colleagues or consultants. For example, a GI issue gets a little too much for functional medicine. You want a good gastroenterologist you can refer to make sure that they get scoped from above and below, that you're not missing any major disease. So conventional medicine and functional medicine can work well together. It's not one or the other. All right, thanks for listening, and I'll see you next time.